So my name is Jane Jones, and I've been a body worker for 30 years now, and an acupuncturist for about 15. I've studied a lot of different modalities because I've never been quite sure whether one technique is going to work for one person or whether it's going to work for another. And I am so happy with the cranial release technique because I finally know I have a technique that's going to help anybody I come across. The reason I took the cranial release training was because of an issue in my own body. All my life, a Q-tip would go directly into my right ear, parallel to the ground. Into my left ear, it would go in at an angle, up around a corner, and I could barely get my pinky finger into my ear hole. So one treatment from Dr. Duresti, and fully I can get an index finger in my ear hole, parallel to the ground. That's how much my cranium changed in one treatment. That impressed me so much that I took the training, and the results I've seen with the work just continue to astound me. To the training, I brought a client's son. We were to bring volunteers to, not experiment on, but to work with. And this lad is 27 years old. At the age of 18, he had epilepsy so badly that they decided to go ahead and have the surgery. And it resulted in a stroke, a coma for 2 months, and now, 9 years later, he lives as a quadriplegic, wheelchair-bound, of course, but not truly quadriplegic because he can just gently twitch his right foot to be able to communicate yes. So the mother showed up with this lad. Dr. Duresti gave him his first treatment. His left leg moved. His mother's not seen that in 9 years. He was invited to come back the following day for another treatment. The second treatment, he lifted his left leg up, kicked his calf forwards, and turned his foot. And I've continued treating him, and the progress has continued so that his muscle tone is much freer. He can move his arms, particularly his right arm, quite a lot now. And he's begun to do things like greet people and say, hi, without vocalization. And he continues to progress in ways that show that his brain is really engaged again. He's begun to be able to express negative preferences, which he never could before. So there was something he didn't want to do. He made discomforted noises, which his mother read and asked him if he would prefer to do something else, which is what he would prefer. He's not been able to communicate that way previously, and his progress continues, as does my astonishment and delight in being able to use this work with anybody I come across.